just very briefly about the CoRE. You've now met Surej. I'm not sure if the map is showing up here very clearly, but as I mentioned, all of the slides are in the Dropbox, in the Google Drive link I've put together. So I just wanted to flag that, as Surej said, he's up here in Uppsala, we're down here in South Africa, and it's a network that is exploring the relationship between migration and health and how to address the need to ensure that migrants along this very important migratory pathway have the opportunity to access good health status, but also to look at how that then impacts issues around migration development and the entire migration journey. You'll see that we have various partners who are along this network pathway. And one of the important ambitions of the CoRE is working with earlier career researchers and doctoral candidates to bring everyone together. So this for us is a really important opportunity and something, along with people like Anuj, Becky and others, Langa and others in the room, who see this as a core part of our work. Many of us work in research centres where our responsibilities are stretched across too many things, but I think it's important to recognise that those of us who have the opportunity to be involved in supervision and working with students, that's what we'd rather spend our time doing than many of the things we get pulled into. So really building capacity in migration and health in that broad field. And one of the ambitions of the next few days is really to interrogate what we mean by the field of migration and health. And we're going to have a chance to do that in this afternoon, really go into some debates, because many people see migration and health as solely this kind of very public health or this epidemiology focused space. In the room, I know that we have people with very diverse backgrounds and online, and we need to work out how we can ensure that colleagues working across different disciplines can work collaboratively within inter and multidisciplinary spaces. So keep that in mind as something when we move on to Surej's input and the rest of the inputs this morning, is to really think about where you fit in, but also where others you have the opportunity to work with fit in. Importantly, we don't see this being limited to people who are part of an academic program or are working within a university system. This applies to colleagues who are practitioners, colleagues working in community organizations, colleagues working in international organizations, regional economic communities. And part of our role is to say, how do we bring all of these actors together? So research is critical, but research is not simply about thinking about those of us who are doing or have done postgrad education. It's not only about those of us who are based or want to be based within university structures. And that's one of our responsibilities collectively to think through that. We use the idea of a whole of route approach. Now, this is important because we know, and we're going to be talking about this over the coming days, one of the limitations of migration research generally is the fact that we too often focus on one point in time and at one place, which is sort of contrary to all of our understandings around movement and mobility. So how do we better engage to think about an entire route, thinking about people moving within, back and forward, when there are times where we're static? I think most people in the room here weren't necessarily born in Johannesburg, but here we are all today. We move at different times for different reasons, for short term or longer term. Some people are forced to move, some of us choose to move. So understanding those vulnerabilities and privileges along this continuum is absolutely key. We also think about a whole of society approach, and some of you, particularly those of you in sort of public health spaces and health governance spaces, will be familiar with this. It's sort of a way of trying to say very quickly, everybody needs to be involved. Taking this very kind of as though we can quickly and easily put everyone together. But it is our job to try and figure out how we can do that efficiently and effectively and not leave certain groups behind who are clearly involved in issues around governance. When we're talking about migration and we're talking about health, we're not simply talking about one small group of governance actors. We're actually saying something quite complicated. Health is political. We know that the movement of people is political too, right? So our job is to find a way to sort of merge together these two politically unpopular areas of interest and importance and find ways to encourage those political leaders, those people who hold that kind of power, to really affect change. So we've got no easy tasks. And then finally, one of the things that Surej and I, but it also is mirrored in work with people like Anuj, people like Langa, is the development of joint postgrad training programs and thinking about how we can expand that into spaces outside of the academy, as it were. So we're starting to implement that. We've met colleagues from University of Wits who have University of Essex. It's a joint degree program. So an opportunity for younger folk to spend time in two very different contexts. We've got, for example, some of the students from Surej's master's program are coming to undertake internships here. We've had early career researcher from Ghana spend time in Uppsala. We're in the process of appointing new postdocs who also will be across those two spaces. And part of this really is thinking through how can we expose people who are training, but also those of us as we continue within our careers and continue trying to learn as we move through, how do we engage across these different contexts where there's a common political challenge, but different ways of addressing issues around migration and health. So I'm going to stop there. This is the background to why we're here. It's an inclusive space, and I'm delighted to welcome you all here into WITS. Some of you know WITS probably better than you wish you did. And for some of you, I think it's a newer experience. So Surej, if I can hand over to you for the first input.